Hello everyone, thanks for taking the time to join us with today's webinar. I'm so glad that we will have the speaker, Dr. Emre Övsay, give the lesson. And the theme of the lesson is about endodontic retreatment and our products, 𝗿𝗄, 𝗿𝗄, and the endophile FF1F retreatment will be used in the cases. For today's webinar, we will have about 1 hour for the lesson. After that, we will have 5 minutes for a break. And during that time, you can raise your questions in the comments. After the break, our speaker, Dr. Emre Övsay, will answer the questions for you. Now, let's get started and welcome the speaker, Dr. Emre Övsay.
Hi everyone, I'm Dr. Emre from Istanbul. I'm very happy to be here with you today to talk about the Fanta dental products and especially for the cases for retreatment. So just to start with, I'm going to give you some information about all the cases and all the problematic solutions you have while you are making your root canal treatment. So also, I'm happy to mention you today that our new file is launching, which I work with Fanta Dental. I work with R&D and created the Rising, which is a very powerful and unique file for you to use in your cases. So I'm a faculty member working in Esteem University, and I'm the global speaker of Fanta Dental. I give many lectures about Fanta products, and I always work with the R&D department. So I know how to get over the solutions with your endo cases, and I will help you with all products to answer your questions. So this is my university located in the west coast of Istanbul. It's a very nice university. So if you have time to come to Istanbul, I will always have a time to have a coffee with you here. And it's a very nice place. This is the our endodontic department in Istanbul University. I work with one of my colleagues, Dr. 𝗿𝗲, and these are our assistants. We have free clinic sessions, we have clinical stuff, and we have good tools and equipments for endodontic applications. So to start with, world is changing rapidly, and a lot of file systems were in the market, and actually usually the clinicians don't know how to use these files because they can use every file in every treatment. So is it true for us to use every file in every retreatment, or does it have the potential to use retreatment files, or what we are going to do to handle the cases? But before going on this, we have launching our new file Rising. So it's a very different file with different technology rather than the files in the market. So if you look at it, what is Rising? Yes, with Rising, we are not offering you endodontic files. We are offering you a system that changes everything. It's a very different file. It's very unique for shaping procedure, and it's very powerful. Maybe it will be the most powerful file you will be ever seen in the market. It's based on a special R&D technology to produce this file. We have been working on the file nearly more than 2.5 years to create that perfection with the Rising. So, what is the difference for Rising? What will be the difference from other files? So we want to use it. So it's basically, it has very special challenges to produce that file, but with the R&D department, we solved all the problems that clinicians are facing while doing your endodontic practical skills. So it makes minimal invasive shaping. You know, when the era is past, and we are using 4-taper instruments for shaping the root canals. It is a variable tapered mechanical instrumentation which stays in 4-taper. So we produced this file based on special technology that it shapes the root canals only in 4-taper, not more than 4-taper, to cause the risk of fracture for the tooth. It has extreme cutting efficiency. It cuts the dentinal walls very smooth, and the specialized cutting angle that has never done before as the most important part of the file. And it removes the debris, the coronal. The Fanta Dental's last file is 𝗿𝗶𝗶𝘁. So when we do the synthetic test on Rising, it has 3 times more effective than removing the debris to the coronal part. So actually, it's very easy to remove the debris, and the amount of debris is increased. So this is the best part that we want to have it while shaping the root canals. And also, there is one reason which is very powerful and very effective, is that it makes cone fit perfectly. Okay, when I do webinars, I give lectures, the clinicians usually come and ask me that, oh doctor, I think root canal with 25.40 instrument, but I cannot fit the 𝗿𝗶𝗁𝘁. I cannot fit the number 25 4-taper 𝗿𝗶𝗁𝘁 to make the cone fit. So basically, Rising has a special technology at the apical tip that makes the cone fit perfectly after the instrumentation. And when you finish the root canal, you have the best cone fit. And after you finish the 𝗿𝗶𝗁𝘁, you get a very nice tuckback without damaging any parts of the apical. It makes a physiological sense to put your 𝗿𝗶𝗁𝘁 to perform the apical plug, which is very, very important for the endodontic cases. What I mean with apical plug is you shape with the instrument, you shape the root canal, then you place your tapered 𝗿𝗶𝗁𝘁 that fits perfectly, because the file creates an apical stop for you to perform your root canal filling, which is most of the important part to have it in your clinical practice. Usually, all doctors has a problem with the apical plaque after shaping the root canals, but with Rising, everything will going to change for you to perform your best cases. So when I go on lectures, I always make a questionnaire. And I ask all the general dentists, what do you use for your clinical practice for retreatment cases? So when I go through the question, I ask them, what kind of rotary system do you use in your retreatment cases? And basically, when you look at this, most of them say that we don't use retreatment files. So most of the clinicians use normal rotary files for their treatment cases, which is not always proper for us to handle these problems. it's very important for us to have a retreatment file. And today I'm going to mention why we have to use a retreatment file for removing the root canal debris and for removing the 𝗿𝗿-𝘁𝗺, which is a very important part of the root canal system. We face mostly everything in the clinical practice, also with the retreatment. For the retreatment cases, it's always hard to negotiate into the root canals. For removing the 𝗿𝗿-𝘁𝗺 procedure, for going to the working length, stuck canals, broken instruments, and bleeding inside the root canal system, it's always a problem for us. Perforations, maybe it's a perforated tooth when it comes to you for your root canal treatment. You have to close the perforation to finish the retreatment, and closing the perforation, it's always a problem. We launch also rising in Dubai, and in the next stop was the IDEX last week. So it's basically take all the attraction for the people in the Congress. Yes, to go with the retreatment, it's a microorganism-based structure inside the root canal system. When you make the retreatment, you have to remove all the microorganisms, all the debris, and all the ingredients in the root canal to perform a good shape, to make it anatomical. And after that, you have to make a hermetic sealing and packing the sealer with the 𝗿𝗿-𝘁𝗺 to complete all the root canal system procedure. It's always a hard case to remove the root canals, microorganisms from the root canals, and it's basically very hard to perform a good treatment, I know. But with the stuff and the equipment you have the power to do this. So for you in your clinical practice, the best part is you use every tool, every technological stuff for endodontic equipment to perform all your cases. So what will I do in retreatment cases? To start with that, you have to use a retreatment file. The reason for it is that the retreatment files has an active tip that removes the 𝗿𝗿-𝘁𝗺 from the root canal and cleans all the environment integrated with the root canals. So if you use a normal shaper file to remove the 𝗿𝗿-𝘁𝗺, it's basically not active. So it stucks into the root canal, turning it around itself without removing any 𝗿𝗿-𝘁𝗺. I know that you have experience that you can say that, with the normal root canal files, with nitrotitanium files, I can do a retreatment. Of course, we have to use them. But before, we have to combine them with the retreatment files. In retreatment cases, it has to start with a retreatment file. That's the point we have to face while going on doing our shaping procedures. After using the retreatment file, you can go to shape with F1, you can use rising, you can use AF rotary, or you can use the reciproc system. It doesn't matter. It's up to your clinical choice. But for the start, you have to use a retreatment file. Fanta's retreatment files are really useful and effective because it's the most elastic file for retreatment, and we don't want to have hard nitrile titanium to remove the 𝗿𝗿-𝘁𝗺. It must be anatomical and it must be flexible to remove all the 𝗿𝗿-𝘁𝗺 from the root canal. So it starts with number 30 with the 9 taper, 8 taper, and 7 taper, starting from 30, 25 to 20. Also, you need to negotiate always with the C file to complete your working length procedure. So basically, you need to use the first files, the blue and the red one, for lower than the working length. Then you have to go yellow one from 2 millimeters now, and you need to C file to negotiate the whole working length. After that, you can start shaping with the shaper file, starting from working length and complete your easily procedure. So basically, the retreatment files are not used in working length. It's impossible because they are active. And we made files smaller to prevent clinicians to use in working length because they have active tip. And if you force the active tip inside the root canal system, it negotiates the dentin and you can have a perforation. So you don't have to use retreatment files in working length. This is the most important and effective procedure that we have to face with it. When we look at the AF retreatment files, it is AFR wire technology, which is very elastic and very effective nickel titanium, high-test nickel titanium. So it is designed to remove the obturation materials. It has a diamond cross-section, an active tip, and a sequence files for various shapes of canals. You know, it's very important to use the files in sequence because the R&D department and we also work on the sequence of the files. And when you use the files, you have to use them simultaneously according to their usage. So if you start with the blue one, you have to go through the red one and through the yellow one, number 20, to finish your root canal treatment. You cannot put a file over them between the files to use making your root canal treatment. Also, we files as endoscope, and it's manufactured various of technology. These are the retreatment files of Fanta Dental, which I always use in my clinical practice for my retreatment cases. There is something special about the files that this is my workout based on R&D technology. So basically, you can use the files in 300 RPM and between 400 RPM with 2 nanometers torque in your clinical usage, in your clinical practice. But for my researches and R&D calculations, I recommend usage the value between 3050 RPM and 2.5 Newton, the torque. Because if you enter a feeling of binding inside the root canal, or if you think that your file is going to stuck inside the root canal system, you have to decrease the speed and increase the torque for penetration procedure. Because, you know, to penetrate into the 𝗿𝗶𝗀 is very important because the retreatment files grabs the 𝗿𝗶𝗀 and easily removes it from the root canal system. So basically, if you think that it's going to stuck inside the root canal and it's there is a forcement inside the root canal, you have to decrease the speed and increase the torque for fast usage. When you use the retreatment file inside the root canal system, you can continue shaping with F1 because it's a very effective file for shaping the root canals. I usually use 4-tapered F1 for anatomical shaping. I have my own procedure in the charts you can check on the website or on the Instagram. So it's basically very useful to use for retreatment cases after using the retreatment files. You cannot just go directly with F1 to remove the 𝗿𝗶𝗀. Of course, it can be possible, but I always advise you from the coronal part to use retreatment files because the orifice shaper of the retreatment file has a special cutting tip to open the orifice for you. And after you open the orifices, you can go directly to middle third and apical third and continue your shaping with F1. It's a special file. It's a very special file, and I love it because it's a self-sided design. It's a safe at the tips. It has extreme flexibility. It's a durable file, and it removes the debris and it removes the debris very efficiently from the root canals. It has inactive tip because it's a shaper file. Active tip are for retreatment files, and it's less aggressive and it fits perfect for your anatomical shaping procedure. So basically, you can use retreatment file and then go through with F1 to continue your shaping procedure. According to studies between the competitors in the market, F1 is much more flexible and much more durable, and the fracture strength is extremely high. But the technology passes from years to years. And for synthetic tests, rising is much more flexible and the fracture resistance is much more higher. So it's a very, very useful technology for the files to change the nickel titanium phase. But F1 is a very good file for shaping. If you look the magnification under the microscope, this is the 20x microscope view of F1. You see it's very flexible for negotiation into the root canals and for shaping procedure. One side is, it's a double-sided. One side is the cutting tip and the other side of F1 is the carrier tip. So when you start on shaping and continue with the F1, you can remove the debris from the non-cutting part to move them to the coronal. So it's a very easy procedure. That's the product video of F1. As you see here. F1 comes from the Formula One. It's 500 speed and 2.5 torque, and very efficient for cyclic fatigue. It says very durable file that you can use after using the retreatment files. This is basically the procedure. You negotiate with the 10K file. You go through the working length, you make irrigation. You can also use F1 as a single file system, but I always use a sequence with it. So it's up to you, it doesn't matter what's your choice, but basically you work with the sequence is much more safer. Of course, irrigation is very important for us. You see it's 500 speed, 3.5 or 3.6 Newton torque. You see how slightly it removes the debris from apical to coronal. You know, irrigation is the most effective part of endodontic therapy. We always make recapitulation. If there is something wrong inside the root canal, we need to see it before the filling procedure. You see the debris removal, it's very smooth, starting from apical and moving to coronal part. It's very, very easy to remove debris. We make irrigation and also for activation, which I'm going to mention after a few slides. It's very important to know the basic sequence of the files. We do irrigation. That's very smooth. It has very smooth shaping skills for your cases. So when you look at this slide, lower F1 is I tested. This is not tested in, of course, in patients. This is artificially tested files. So the lower F1 is the new F1, brand new without any usage, and the F1 at the upper part is used in a metal block in a plastic block, which is filled with a 𝗿𝗶𝗀 and tested many times. So the upper part of the F1 is the 10 usage of F1. So you see how powerful it is. The upper part is the pen usage of F1 for after the retreatment files in a plastic block, and the lower is the new F1. So it's durable, but we always advise you to use the files for one time during your clinical practice. But when we make artificial tests, we test the files many times, so it's so powerful to use during your clinical practice. So to go directly with the chances, a patient comes to your clinic and it has problems with the right lower jaw. There are two tooth. The patient has pain and pus coming out the soft tissue. So we have to understand how to solve the cases, how to get over these problems. So there are two tooth. The number 6, the 46 and 47. So we have to treat this tooth for the painful procedure because one has lesion and the other has caries. So to divide the case into parts, of course, I always start with the retreatment file. I don't like to make two tooth in one session, but actually in some cases, the patient has no time. This patient was coming from the United States and needs to take the plane to go back to this country. So basically, I place my rubber dam for the two tooth and open for the shaping procedure. For retreatment files on number 46, I remove all the 𝗿𝗶-𝘁𝗺. And after removing the 𝗿𝗶-𝘁𝗺 procedure with the teeth with pulpitis number 47, I use AF blue rotary Essex for the orifice shaper. I calculate and find my way with the C-flex, and I go treat number 13, number 20, and number 25 F1 file to complete my case. So if you calculate the tools and instruments which I use basically 3 retreatment files, 1, 2, 3, 4 shaping files, and a one-hand file. So it's not easy to make a retreatment. You cannot do retreatment with just one file. You need to use all analytic equipment and stuff to solve these kind of cases or these kind of problems. So this is the best part that we have in hand. We have weapons to solve these problems. And as you see in the first picture, okay, there was a lesion at the apical and the mesial roots. And after 6 months, the lesion healed. So basically, when you look at the radiograph, the treatment seems the same. It's the first radiograph and the final radiograph are nearly equal to each other in vision. But you do activation procedure, you do shaping procedure, you grab and remove all the ingredients outside the root canal system. And if you see, there was at the molar, number 47, there's, as you see here, there are lateral canals, which I use Actor 1 Pro to clean the root canal very efficiently. And after that, I make the down packing and I make the filling procedures with heated with the 𝗿𝗶 system, e-filler, to complete my case. And as you see, after 6 months, the lesion healed. So for endodontic therapy, basically, it's not only important part is not going through the apical, okay? Everyone goes to the apical, but the most important part is to minimize the number of microorganisms with effective irrigation and effective activation procedures. So after it, sorry, you can make the root canal filling with the hermetic seal, and you can use warm, heated with the 𝗿𝗶 systems. When we talk about going to the apical, basically, when you look at the radiograph, it's not especially what you see is the tactile sense what you see. So when you take the radiograph and you look at the right picture, you can see that you are on the apical. But especially when you use the apex locator, you understand that you are over the apical. So this is most of the basic problems when you face making your clinical practice. As you see here, when a file is inserted and moves through the apical, and if you take the radiograph as a final step and you don't check with the apex locator, the patient will have a pain after the filling because you will be overextended. But in that case, you have to trust your apex locator. So in this case, I always use in the clinical practice 𝗿𝗄𝗂, and it's very efficient to calculate the working length. I tested 𝗿𝗂𝗂 many times according with the R&D department in my cases and in artificial blocks and everything. It just gives very accurate results. So you need to check your radiograph with your apex locator, but the apex locator needs to be from a trustable brand. So you can trust 𝗿𝗂𝗂. I tested it many times. I use in my daily practice. You have to equalize radiograph with the apex locator's findings and need to go through your therapy. Rising will be released in a short time. So after Rising release, we are going to release also Rising retreatment files, which will be the most special file and which will be the most effective file in the market. I believe that. And for the retreatment kit, the first file will start with Rising RR also, because Rising RR is the orifice shaper of the Rising. That says triangular section, and it has active clip. So it's perhaps to get a 𝗿𝗂𝗁 also to remove from the root canal system. Let me show you a video using the Rising RR. That's my colleague's case, Dr. 𝗿𝗂𝗁 case. I gave them the Rising file. I gave her the Rising files to test. She told me that I have a retreatment patient. Can I use the orifice shaper as a retreatment file? And I said, of course, you need to use. Look how the Rising RR grabs the 𝗿𝗂𝗁 from the orifice. And of course, with irrigation. You can remove. You need to negotiate with an explorer. Then you can, after removing the 𝗿𝗂𝗁 from the coronal, you can continue with your shaper file to complete your root canal treatments. Irrigation and activation is the most effective part, also for normal cases and also for retreatment cases. As you see, you can go through the shaper files. This is the Rising system. After removing 𝗿𝗂𝗁, it's very clear to use the shaper files. So we have another case, another patient. It's a very long story for the patient because patient goes to his dentist. There was stuck instrument inside the root canal system, and there was a periapical lesion. So the patient has an appointment from me and told me that I have a stuck instrument inside my root canal system. You have to remove it. So basically, all in retreatment cases, we have to face some issues like this because you cannot just remove the 𝗿𝗏 and to make your treatment. And sometimes, in this case, this is a retreatment case. There's a stuck instrument inside root canal. So what will you do with that instrument to solve that problem? So most of the dentists are afraid of retreatment. But if you use the right tools and right endodontic files, you can solve your problems. So I talked with the patient that I take a radiograph from both sides, and I decided not to remove the instrument, to bypass the instrument because it's in the anastomosis point. So if I try to remove the instrument from the root canal, there will be a perforation. So you have to decide what to do inside the case, because removing the instrument is not a problem for you, I know. But the basic problem is after removing the instrument, how many dentin you remove. So if you remove the instrument and the tooth goes for extraction, it's not important. Best important part is to solve the problem. So I started with the 𝗿𝗶𝗁𝘁𝗺, removing the 𝗿𝗏 with the retreatment files, and then I bypassed the instrument with the Fanta AF1. And as you see in the radiograph, the lower radiograph, I bypassed the instrument and the anastomosis point, and I filled my root canals with my 𝗿𝗍 and down packed the 𝗿𝗏 inside the root canal for the hermetic sealing. So it's important to have a use the retreatment file to remove the 𝗿𝗏, the 𝗿𝗏-𝘁𝗺, and the F1, my F1 sequence for solving this case. It's always important to have the best point of F1 is if there's a stuck instrument inside root canal, you can bypass it with the F1 system because it's a self-sided system. With the cutting part cuts the dental walls, and the other non-cutting part tries to negotiate the instrument to remove the instrument from the root canal system. We have a case like this. It was a very interesting case. This root canal has done before 9 years ago. And there's an apical lesion at the mesial root, and also the coronal restoration is very bad. So we have to make this a retreatment because also the patient has a pain. So what will we do to solve this case? Basically, I always start with the retreatment files. So I remove all the 𝗿𝗏 inside the root canal, and I go to working length with my reflex. Then I start using my F1 sequence for finishing my root canal therapy. As you see here, I used basically 5 instruments to finish my endodontic case. So single file technique is not proper for retreatment cases. You need to always use retreatment files to combine with your shaker files. And the effectivity of F1 is very unique to open the pathway to apical. In number 13, F1 is a extremely nice glide path file and very effective for opening the glide path. So you can just go directly to the apical with the number 13 and continue your shaping with the 4 taper instrument F1. So you can manage this case very easily. And it starts from here and comes to here, as you see. So if you go through the apical, it will be very long-lasting case. This tooth has been root canal before. The patient has gone on orthodontic therapy. You know, after the orthodontic therapies, the tooth can have resorption at the apical, or there can be a lesion. So in that kind of cases, you have to take the X-ray to find out what you need to do. And as you look here, I removed all the 𝗿𝗶𝗀 with the retreatment files very easily. And I go through with AF rotor file here. This is my choice. You can go through with F1 also. And you see the apical delta at the apical parts when I finish the root canal treatment. When I post some pictures on Instagram, the general dentist or endodontist texts me messages how you do this apical plug or apical delta filling. That's because of Actor One Pro. So we cannot just mention only retreatment. It's a combined procedure. In retreatment procedure, there are retreatment files, shaper files. You need a good activator, ultrasonic activator. You need very nice downpack device and very efficient sealing devices to complete your whole procedure. So I go to mention about something about Actor One Pro, which is a very effective ultrasonic. So it has 1006 milliampere battery, which is a very powerful battery. For when I work with the R&D department, it's basically for cordless devices. The most problematic part is the battery, because you buy a device with 1000 milliampere battery, and after usage, the battery wears out, and the power of ultrasonic decreases in time. So in Actor One Pro, the battery is decreased to 1600 milliamperes, so it will be powerful as effective, and very, very nice front light. So when you make the activation inside the root canal, you can have a light to see root canals very easily. That's wireless charging, and it has different tips, nickel titanium tips, which doesn't make any harm inside the root canal system. But basically, the most important part is with the Actor One Pro is the technology. As you see under the microscope, it's the new ultrasonic technology that starts with sonic vibrations, as you see here, but it turns to ultrasonic when it is heated. You see the bubbles? The bubbles will come across the tip of the Actor One Pro. After the sonic movement, it goes directly with ultrasonic activation. So basically, it's a combined procedure, and it's very important for us. You see, when the tip is working, the acoustic stream and the cavitation procedure starts. And it is so powerful and very effective for activation process. So you need a whole system. You cannot just deal with the cases just with the normal basic irrigation needle. This is the usage of Actor One Pro. You see how powerful it removes the debris from the root canal system. Activation is the most important part. As you see, it's so powerful. You need to activate sodium hypochlorite inside the root canal. We make a sodium hypochlorite reservoir to work inside the pulp chamber. Very powerful and effective treatment. So after a month, we are going to publish our research about 𝗿𝗿-𝗁-Pro compared to the battery mode and the battery power compared to other operation devices on the market, which is 𝗿𝗿-𝗁-Pro is very powerful. So this is the story of another patient which come to me, and I was busy for the appointment. And these days, this patient preferred to go to another dentist because she has a pain from that tooth. So he made the treatment of the lower molar, but time passed, and she need to start to have a pain with the lower molar. So she come to my office and said, I was expecting you to have an appointment, but we were busy, so I went to another dentist, and he treated my tooth, but I have pain on that tooth. So generally, I advised her to go back to her dentist to ask him what is the problem. So she went to her dentist, and the dentist said her that everything is fine. It's a very nice root canal, so you don't have to be worried about this situation. And after that, the dentist said, I'm going to make your corona restoration. Don't worry, everything is going fine. So the time passed, 3 weeks passed, and the patient come to my office again and said that, doctor, I went to my dentist. He told me that I don't have any problem with my tooth, but I'm feeling pain, and it's not proper for me. I think that there's something about this tooth. Can you check this for me? I said, okay, I will help you. Don't worry. I will try to understand what is the problem. You know what is the problem? The meat mesial is the problem for that case. So I need to do the retreatment to complete that procedure. And as you see, I started with the 𝗿𝗿 shaper. I use the retreatment kit. Then I go through to use the F1 sequence. Then I finished my therapy. And as you see here, I reached the apical easily. And to compare the stuff here, as you see, the first radiograph is not treated by me. The second is my treatment. So I go through the orifices, find the extra canal, remove all the 𝗿𝗿-𝗁 from inside the root canal system, use the F1 sequence, and finish my endodontic therapy, which is very interesting case. And so the patient's pain has gone off, and he was very happy with that, and she had the coronal restoration. My downpacking device is 𝗿𝗿-𝗁. I downpack the 𝗿𝗿-𝗁 in that cases, and in my all cases, I use my downpack device to go through the packing the 𝗿𝗿-𝗁 very easily, because that is a power of 200 degrees. So you can easily remove the 𝗿𝗿-𝗁 from coronal parts to make the compaction. To go directly with another case, this is another retreatment case, which is treated 5 years ago. The patient come to my clinic was having pain. So I used the retreatment kit for removing the 𝗿𝗿-𝘁𝗺. Then I go directly with the normal shaping file. But there's an exception here. In one route, I use the F1, but in other route, I use the blue reciprocal. So I finish my therapy using the F1 sequence. I sometimes do some different things like this to test the performance of the files. You can just go and finish the case directly with F1, or you can use the blue reciprocal to finish the root canal treatment. Doesn't matter. But you need to have a retreatment file kit to remove all the 𝗿𝗿-𝘁𝗺. So basically, I don't always put the retreatment file system pictures on the cases, but I'll explain to you while explaining the procedure. So you need a retreatment file kit and a shaper kit to finish your retreatment cases. And you can be the 𝗿𝗿-𝘁, so you can easily finish your endodontic therapy. And there's a tooth here. So you need to be treated this tooth. This is not a retreatment case, but I put this case to show you the calcification in the root canal system, because also you face some calcification issues while making your treatment. In that case, I used F1 to negotiate the calcified root canals and open my pathway with the C-flex, so I can finish my treatment easily and effectively. So it's just a procedure to understand how the file systems work and how to use them in your clinical practice. The general dentist come and ask me that why do we need a retreatment file system? So in snowy days, you need tires, snow tires, to use your car. In hot days, in summer, you need summer tires to use on your car while driving. So in retreatment case, you need a retreatment file system to solve that issue. So most of the clinical experienced doctors don't try to use retreatment files, and they think that they say, well, I have a problem. Why cannot I solve that case? Because you don't use the retreatment file. So you use the files according to its basic sequence, and you can solve that problem easily. This is the final radiograph for that tooth. After I use my downpacking device, the e-heater, I use my 𝗿𝗿-𝘁𝗺 device, e-filler, which is a very useful system for backfilling. Some other brands try to sell some filling devices with cord, not cordless in the market. But the most effective design for the 𝗿𝗿-𝘁𝗺 devices for obturation is the e-filler, because it's a very easy handle to use and to press and apply into the root canal. There's also a very powerful battery, like 2,600 milliamperes, so you can use in most of the cases without charging. You don't need to charge the product every time. So it is very easy to use and very effective. So the most important part is the adjustable temperature, because wider temperature range adapt to more 𝗿𝗿-𝘁𝗺 points. And basically, all the 𝗿𝗿-𝘁𝗺 are not the same. Of course, the main material is the same, but the heating procedure differs. And in some cases, maybe you don't need to have like 330 degrees 𝗿𝗿-𝘁𝗺. Maybe you need lower degrees. So you can adjust the temperature just pressing the button, black button here, to understand your usage very easily and effectively. And It has 4 tips that adapts all the root canal system, and you can bend the tips easily to apply inside the root canal, and it's very easy to use and very effective. This is another case done by my colleague, Dr. 𝗿𝗲. I want to put here. There was a retreatment case. It started with the AF retreatment file, removing the 𝗿𝗿-𝘁𝗺, and finish the shaping procedure with the rising. So, the next webinars, we are going to talk about rising technology, but I just want to put some part of it inside my lecture to make you more understanding our new file system. So we go through the cases. We mentioned about how to solve the cases for different applications by using the Fanta dental products. Especially, you need to have a complete system, because endodontic is not a basic application. That's a complicated procedure. So you need to have all your equipment for your every case, because the cases are not the same. It's always different. It's always another story to solve. Of course, it's not possible to explain you all the details in 1 hour or 50 minutes, but I just want to go through the checkpoints and the most problematic parts of retreatment procedure to understand the usage of retreatment files and usage of shaper files, how to solve our problem in our clinical practice. It's very important to use magnification, microscope, to find the extra canals, for cleaning the dental walls, for removing the 𝗿𝗿-𝘁𝗺. Activation part is also important. You need a good ultrasonic activator to get over that cases. To sum up all the procedures, you need to start with the retreatment file. You need to go through with the shaper file. You need a good activation, and you need a good 𝗳𝗿 downpacking with the flowable 𝗿𝗿-𝘁𝗺 system to complete your all cases, to understand every detail and to solve all problems when you face at your clinic. I want to have special thanks for attending to my lecture. If you have any questions after the webinar, or after a week, or after a month, it doesn't matter. You can just follow me from the Instagram, and you can ask your questions. We can deal with your cases. You can send me your radiograms. Thank you for today.
Okay, now we will have a 5-minute break, and after that, please leave your questions in the comments, and the speaker Emre Övsay will answer the questions for you.
Okay, there was a very good question from my colleague, and I want to answer it. And thanks for the question. The question is about the AFF1 flat surface. What's the advantages of this flat surface for the file? So basically, F1 is a very special file created with a special method of microcontainment. And especially the cutting part cuts the debris inside the root canal, and the flat surface removes the dentist to the coronal part. So that's you can think it's just a spoon, like cutting edges. That's the dentinal wall, and the flat surface carries the debris. So this prevents the file to stuck inside the root canal system, which is very effective and very clever method for producing that file. So basically, it's the most important part of F1, of course, and the files with the non-cutting tip are always mentioned as safe file. So it's also a safe file to use during your treatment procedure.
Okay, today's webinar is finished. And many thanks to Dr. Emre Övsay for bringing us the wonderful course. And thanks to all dentists for your participation in today's webinar. And keep in touch on our Fanta page and look forward to your arrival at next webinar. Thank you. Bye.
Thank you. Bye. See you next time.
See you.
See you.